Hello and welcome back, my friends. If you're new here, my name is Laura, and I usually make videos about hypermobile Ehlers-Danlos syndrome to help educate, raise awareness, and share my experiences and advice living with this condition. But today I am straying away from my usual hypermobile EDS content to talk about Brittle Cornea Syndrome. This is part of a series where I give each of the 12 rarer subtypes of EDS their own introductory educational video. I have a few videos out already, and stay tuned for future videos in the series. So what exactly is Brittle Cornea Syndrome? Brittle Cornea Syndrome, also known as BCS, is an extremely rare condition that causes the cornea to be thin, fragile, and prone to rupture. The cornea is the outermost clear layer of the eye and is involved in refraction of light entering the eyes. BCS also causes blue sclerae and joint hypermobility. The sclerae are the white, or in this case blue, outer lining of the eyeball, commonly called the whites of the eyes. Joint hypermobility refers to joints that move past their normal range of motion, sometimes called being double jointed. BCS belongs to a group of 13 related genetic connective tissue disorders known as the Ehlers-Danlos syndromes. The hypermobile subtype of EDS is by far the most common, accounting for about 90% of all EDS cases. Brittle cornea syndrome is an extremely rare condition and accounts for less than 1% of all EDS cases and has a prevalence of less than 1 in a million people. BCS is caused by genetic variants found on the ZNF469 and PRDM5 genes. These genetic variants negatively affect the way the body produces connective tissue, which provides support, protection, and structure throughout the body. BCS is inherited in an autosomal recessive pattern. This means if a person inherits the genetic variant from both of their parents, they will have BCS. People with only one copy of the genetic variant are carriers of BCS, and carriers do not have BCS themselves, though some carriers of BCS do have eye problems. Brittle cornea syndrome is diagnosed through genetic testing, and genetic testing should be considered on anyone who meets the diagnostic criteria for BCS. To meet the diagnostic criteria for BCS, a person must meet major criterion 1 and at least one of the other major criteria, or major criterion 1 and at least 3 of the minor criteria. Major criterion 1 is thin cornea with or without rupture. Typically, the corneal thickness will be less than 400 micrometers. Criterion 2 is early onset progressive keratoconus, which is when the cornea becomes thin and gradually bulges outward into a cone shape, causing blurry vision and light sensitivity. Criterion 3 is early onset progressive keratoglobus, which is very similar to keratoconus. The difference is that the thinning and bulging of the cornea is more evenly spread out over the cornea with keratoglobus and not just centrally located as with keratoconus. Criterion 4 is the presence of blue sclerae. The 14 minor criteria include enucleation, meaning surgical removal of the eyeball, or corneal scarring as a result of previous rupture, progressive loss of corneal stromal depth, especially in the central cornea, meaning progressive thinning of the center of the cornea, high myopia with normal or moderately increased axial length, meaning severe nearsightedness with normal or somewhat longer of an eyeball shape, retinal detachment, meaning detachment of the back tissue layer of the eye, progressive hearing loss or deafness, hypercompliant tympanic membranes, meaning abnormally floppy eardrums, developmental dysplasia of the hips, meaning a defect of the hip joints found at birth or early childhood in which the hips are at a high risk of dislocation due to the shape of the joints, hypotonia in infancy, meaning low muscle tone as a baby, and this is usually mild if present, scoliosis, meaning an abnormally curved spine, arachnodactyly, literally meaning spider fingers, which are long, thin fingers, hands, and wrists, hypermobility of distal joints, meaning hypermobility of the fingers, hands, wrists, toes, feet, and ankles, pes planus and hallux valgus, meaning flat feet and bunions, mild contractures of fingers, especially the pinkies, meaning mildly curved inward fingers that can't straighten out, and finally, soft, velvety, and translucent skin. Because brittle cornea syndrome is a genetic disorder that you're born with, there is no cure, but there are treatment options available. BCS is managed by treating the various symptoms that each individual is experiencing. There's no one-size-fits-all treatment. Key aspects of care will usually focus on preventing corneal rupture by wearing protective glasses and monitoring for vision and hearing issues. Treatment options to help manage the many symptoms of BCS may include medication, pain management, joint bracing, mobility aids, surgery, and physical therapy. Do you or anyone you know have brittle cornea syndrome? Let me know down in the comment section. I'd love to hear your story. If you thought this video was helpful, please click on the like button. If you want to see more videos like this, subscribe to my channel, and don't worry, it's completely free. If you click on the notification bell icon, you will be notified when I release new videos. As always, thanks for watching and see you next time.